Thank you. Please tell us about the 5 key facts as we all should know about ovarian cancer.
Well, first of all, people need to know that ovarian cancer is the leading cause of gynecologic cancer death. It's also the 5th leading cause of cancer death in women in the United States. It's estimated that in 2018, about 22,000 women are going to be diagnosed with ovarian cancer, and approximately 14,000 women, unfortunately, will die from ovarian cancer. Part of the reason is because ovarian cancer is mostly diagnosed when the cancer has already spread. If we could diagnose ovarian cancer early, in the early stages, over 90% could be cured. But 4 out of 5 women who are diagnosed with ovarian cancer come to us when the disease has already spread. The 3rd fact we need to know is that there's no good screening test for ovarian cancer. So we don't have ways to screen for it or detect it early. And so a lot of research is underway in many centers, such as KU Center, Cancer Center, and other places to find new ways to screen and detect ovarian cancer early. The 4th thing that I would say, though, is although ovarian cancer is deadly, we have made some leaps and bounds and strides and advancements in treatment, and women, in fact, are living longer with the diagnosis of ovarian cancer.
Which is great news.
It really is very good news. But I must say we have to do better. So I'm really excited that you've given us the opportunity today to talk about all of this, because we need to raise awareness in the community and the greater public about ovarian cancer. And we need more research to really push the envelopes that more women can live longer.
Thank you so much for that answer. In the absence of a screening test, what are some of the prevention strategies for ovarian cancer that everyone should know about? And also, you know, recently there were articles being published on that, you know, ovarian cancer screening is not for the general population.
Right.
What would you say to that?
Well, the first part of the question is what can we possibly do to prevent ovarian cancer? Well, we do know that a certain percentage of ovarian cancers are related to genetic mutations that are associated with the risk of developing cancer. So the most common ones are genetic alterations in the genes BRCA1 and BRCA2. These mutations predispose women and men to developing a variety of cancers, including breast cancer, prostate cancer, and ovarian cancer. So we tell people that it's so important to know your family history, first of all. And there are recommendations now that if a woman is diagnosed with ovarian cancer, we recommend she undergo genetics counseling and testing, and that her family does as well. So that in women who have this gene mutation and they don't have cancer, if they're not done with childbearing, then oral contraceptives can reduce the risk. Having babies can reduce the risk in breastfeeding, and once they're done with childbearing, actually removing the ovaries and fallopian tubes can reduce the risk of developing ovarian cancer.
May I ask you a quick question on the contraceptives?
Yes.
So what is the period of usage for this? I mean, is it a few number of years, or is it extended amount?
So up to 6 years of oral contraceptive use can decrease the risk of ovarian cancer by about 40%.
That's significant.
So that is a significant reduction, yes.
Okay. And so on the second part of the question
Yes.
was that what should we know about the recommendation on not screening women who are at low risk for ovarian cancer?
So the 2 tests that are available that have been used in multiple studies throughout the world, in the United States and the United Kingdom, are the largest studies to date. Use a combination of a blood test called the CA-125. It's a protein tumor marker that unfortunately is not a really good test. It can be elevated sometimes when a woman does not have cancer. It can be elevated for other reasons, or it can be normal and a woman in fact does have cancer. So it's not a perfect test. But the blood test and a transvaginal ultrasound in combination have been used in multiple studies to see if we could use these tests in an average risk population, women who don't have the family history, and if we could perform these tests on a regular basis, maybe we could detect ovarian cancer early. Unfortunately, those studies have not proven that we can actually change ovarian cancer deaths by using this method in an average risk general population. Mm-hmm. Now, what people need to understand is that's for screening, people who don't have any symptoms. But we often use those tests to diagnose ovarian cancer when somebody has a symptom or when somebody has developed a mass by other tests, other imaging, or on exam.
Mm-hmm. Okay, thank you.
Yeah.
The next question that I have is cancer and its treatment, as you know, can affect a person's ability to have children, and
Yes.
it can have tremendous psychosocial and psychological impact on the person.
Absolutely.
So what would your advice be on fertility preservation strategies for younger women who get diagnosed with ovarian cancer?
Well, first I'd like to say that most women diagnosed with ovarian cancer, the median age is in the 60s. So most women, they're already done with childbearing. They've actually gone through menopause, the vast majority of women who are diagnosed with ovarian cancer. Now, there are some rarer subtypes and some women who have this family history of ovarian cancer where the cancer occurs earlier in younger women. And we have new methods to hopefully work with women and deal with these issues of losing fertility at a young age, because part of the treatment of ovarian cancer is to remove the ovaries. Mm-hmm. Now, depending on if it's an early ovarian cancer, maybe the normal ovary, we may be able to harvest eggs, and so there's a possibility for fertility later. In combination or collaboration with our reproductive endocrinologists and fertility specialists. But most of the time when ovarian cancer is widespread, we would recommend removing both ovaries. Now, in a young woman, removing both ovaries puts her into an abrupt menopause. So that definitely affects quality of life. And it affects other health concerns, bone loss, osteoporosis. It may affect sexual function because the hormonal levels have abruptly been removed. And so these are concerns that women who've been diagnosed with cancer have asked us to really look at as physicians and scientists and come up with better ways of managing these symptoms. And quality of life, I think, is an important issue that we still need to work on a lot more.
Okay. And then, as we all know, that ovarian cancer, unfortunately, has a very high probability of recurrence, right?
Yes.
And so, can you discuss the latest advances in treatments for ovarian cancer? And we know that a lot of strides have been made in the past 5-6 years. So, has survivorship been redefined because of these treatments? And are women with ovarian cancer living longer lives? And what would you share in terms of your insights in terms of reducing the risk of recurrence for women already diagnosed, and anything that they might do in terms of reducing their chances of,
Well, I would say that the number one risk factor is what happens with that initial diagnosis and that initial treatment. We know that with metastatic or widespread ovarian cancer, if we can perform an aggressive surgery and get rid of the cancer so there's no visible cancer left, no cancer that we can see with the naked eye, in combination with intensive chemotherapy, that combination right off the bat, that reduces the risk of recurrence, okay, significantly. So getting it right the first time is the most important message. Unfortunately, in the United States, more than 50% of women are not taken care of by specialists who really know how to do these surgeries and who know how to administer the proper chemotherapy.
Is it really 50%?
It's in some areas it's more because people don't have access to specialists, and we are encouraging people to understand that it's important to get to the right doctor the first time. So asking for a second opinion and getting to the right place is extremely important. So we're fortunate because we're at an NCI designated cancer center. We have all the specialists here. But not every place has this multidisciplinary specialist in practice, and so referring people to get the right care is important. In addition, there are new treatments coming down the pike, so clinical trials are really important, and access to those new treatments is important through clinical trials. And finally, there are new drugs that have just been approved by the FDA in the past year called PARP inhibitors that are a new class of drugs. The first time we've had a new class of drugs approved for ovarian cancer in many, many years. So these are promising new therapies that are available for women when the cancers come back, and they have really been shown to be effective in prolonging women's lives significantly. Yeah.
That's encouraging.
Yes, yeah.
So, and what message, this is my last question, so what message would you have for our audience when it comes to ovarian cancer awareness as well as survivorship?
So first of all, awareness, knowing your family history is really critical. Getting to the right doctor and asking for a second opinion is important. And then the third fact of survivorship, I think of the fact that it's not just the physicians taking care of you, but making sure that you have a support team around you, family, faith, friends, and then being cared for in a center that has additional services. Psychology, oncology, really dealing with the fact, especially if you're a survivor but you have symptoms. So do you feel guilty or bad that you have these symptoms but you're cancer-free? And how do we address those issues? There are a lot of psychological, emotional, existential questions that come up with being a cancer survivor. And I think support groups are really important, and advocacy groups, and really contributing to spreading the word and raising awareness sometimes help people feel better about their own experience, because then they can spread the word and help others. So that's what I think.